sticking with the theme of addiction today, really excited to speak to everyone. My name is Yusuf Sherwani. I'm the co-founder and CEO at Quit Genius. My personal background is on the clinical side of healthcare. And the origin story really is that as a doctor, I realized that we're really good at labeling people with a diagnosis. But one of the things I really struggled with professionally was just how fall we short when it comes to actually delivering the end-to-end chronic condition management, particularly for highly stigmatized issues, such as an addiction or mental health, situation that actually gets people back on track. So Quit Genius is really the result of my own personal experiences on the front line, just seeing how many barriers existed when my patients would try to access evidence-based treatment for addiction. Our mission is quite simply to empower individuals to conquer their addiction, and in doing so, also help payers and employers reduce some of the cost curve associated with treating those addictions if left untreated. So why do employers and payers care about it? Well, for them, it's a real business issue. Our observation is naturally that employers are highly focused on the top line items of medical claims. But the challenge has historically been that companies have looked at addictions in a silo. Now, it turns out that when you dive a bit deeper, addiction is clearly one of the top 5 drivers of healthcare spend on the same order of magnitude as other high cost areas, including diabetes, musculoskeletal care, and mental health. And today, Quit Genius is a market leader in the substance use disorder treatment category. So what's driving that cost? Well, the challenge is that employers face solutions that are siloed and passive. So on one side, you have EAPs and wellness programs. They're not really purpose built for addiction. They typically see minimal engagement, but they're also not built to deal with highly complex cases like a substance use disorder. And then on the other hand, you have health plan resources, which are passive and incredibly expensive. So they reach fewer than 8% of people with a substance use disorder. And when you do engage, you're suddenly hit with co-pays, long waiting times, high cost, and have to overcome the stigma associated with going to rehab. And that's why we built Quit Genius in the way we have. It's really the world's first digital clinic for tobacco, alcohol, and opioid addiction. Our approach has been to take the time-tested therapies such as cognitive behavioral therapy and medication-assisted treatment and really reinvent how they would be delivered in the 21st century if they were invented today using a 100% virtual care approach. So in a nutshell, what that means is combining the human clinical care that's available through our own prescribers and network of behavioral health counselors in conjunction with connected devices, easy access to medication, and programmatically delivered content that's personalized to the user. And in doing so, we've created a new model of care that's just radically different to that fragmented way that addiction care is delivered today, where people frequently fall through the cracks or receive inappropriately expensive care. We've also made partnering with Quit Genius very easy. So if you're an employer, you could partner with Quit Genius and dramatically simplify the security review, contracting, and billing process by purchasing it via your PBM or your health plan or even your wellness solution. So an example of this is our recent partnership with Express Scripts, which allows clients across all 3 of our programs to be able to bill for the Quit Genius program through their PBM on their own paper, removing the need for direct contracting. Now, clinical outcomes also matter, and we care very deeply about clinical outcomes. So we've now published 8 peer-reviewed studies, including a randomized controlled trial that show best-in-class outcomes. And on top of that, we're able to put fees at risk to prove that the program works. And finally, as a sense of scale, we're already the category-leading digital clinic for addictions by a wide margin. In the past 12 months, we've grown revenue 10x. And we now partner with 60 enterprise clients, including Fortune 500 companies, national health plans. We're covering over 2.5 million lives. And to date, our programs have enrolled 750,000 members. In July, we announced a $64 million Series B funding round, the largest in our category. So to summarize, Quit Genius is the world's first digital clinic for multiple addictions. If you're a health plan, if you're an employer, if you're a potential partner, please do reach out. And in the meantime, happy to answer any questions.
Thank you, Yusuf. It was great. Congrats on all of your success. Walk us through what it means to partner with you. How does the pricing work? And tell us a little bit more about the model.
Absolutely. So On the pricing to start off with, so one of the ways we've innovated in addition to the product itself is the business model. What that means is we really don't like fee-for-service approaches or per employee per month approaches. So it's all about charging only for people who enroll in the Quit Genius program, and then putting meaningful fees at risk that are tied to engagement and clinically meaningful outcome markers. So that's our approach to value-based care. It's all about charging only when people enroll in the program, and then we'll put up to 50% of our fees at risk, which are tied to your population actually achieving good results. In terms of how we partner, we're able to cover your population, whether you're an employer or a health plan. We'll typically partner in a few different ways. With health plans, we could be a vendor, we could be a provider that's a network. We have the ability to submit claims directly as a healthcare provider ourselves that's licensed in multiple states. If you're an employer, we can directly contract, or we can contract with you via our PBM or health plan partners. If you're a wellness solution or another vendor in the space, and you have clients that need a substance use disorder program, we can also partner with you.
So there's quite a few folks in this space. You're certainly breaking out from the pack. You just raised a Series B. Congrats on that. Talk to us about where you fall in the competitive landscape. How do you differentiate yourself, and how would you position yourself?
Yeah, that's a great question. I would say the key differentiators for us is our ability to go across the continuum of care and do so for multiple substance addiction. So today, there's no other vendor that's available on the market, to our knowledge, that is able to help a population with not just tobacco addiction, but also alcohol and opioid use disorder across multiple addictions, including combinations of addictions. So it is a single dynamic program, irrespective of whether you have multiple addictions. But in addition to that, we can really work across the continuum of addiction care. So whether you're at the prevention stage or you have a DSM-5 kind of diagnosis with an alcohol use disorder and an opioid use disorder, and you need intense MAT that needs to be delivered virtually, or your post rehab, where you've maybe gone to a hospitalized program for 4 to 6 weeks, you've been discharged, and you now need long-term maintenance to ensure that you don't lapse back into addiction care again, into your substance misuse again, then we can help across that. It's also very easy for Quit Genius to integrate within your existing benefit ecosystem. So oftentimes we'll be working with a client that's already made significant investments in a mental health solution, for instance, or primary virtual care. So the ability to actually integrate with that existing ecosystem and hand off patients in the right context and situations, as well as receive warm referrals, is again something that we've been able to custom build through our Addiction Care Navigator tool.
So a couple more questions. One is related to the question I just asked, but I want to see if you want to add anything on. He says, I've seen several companies like this. None seem to have IP, so the business will succeed by developing relationships. What will be needed to be a leader in this space? And you just outlined a couple of things you've done, but is there anything else you've pinpointed as you think will be critical to being the leader in this space?
Yeah, I think it's a very nascent space. So it's only recently, because of regulatory changes as well as just the sheer increase in prevalence, that it's become important for employers and payers to be able to offer virtual solutions for these types of problems. I would say kind of like the really defensible stuff over here is a few different things. So one is the technology platform itself. So our ability to really customize and create a personalized treatment plan based on where somebody falls on the continuum of care, including what comorbidities they have, whether they have a comorbid mental health condition or multiple addictions, as well as their social determinants, is quite unique. You require a lot of data to do that. So our experience, having enrolled hundreds of thousands of people into the program, we know specifically which tools can be matched to those individuals. And then the second component is our provider network. So we've painstakingly taken the approach of building out our own provider network, which includes our own network of prescribers and licensed drug and alcohol counsellors across all 50 states. So when you start to partner with a national health plan, they do care very deeply about your ability to service their entire population. When you're working with a Fortune 500 company, as we do, they have employees in every single state. So they don't want a patchwork of coverage. They want that real national coverage, and that's something that doesn't exist. And over time, actually gets stronger because the more clients you attract, the more they want to see that network, and then the more providers want to work with you because you have a critical mass in the space.